Medical anthropologists, anthropology relate to the whole field of interprofessional collaboration. And from an anthropological perspective, or medical anthropological perspective, and within a society, and there are various what we call subcultures, and there are dominant cultures, there are subcultures. And people, even we all live in society, that means we share exactly same values. We do not practice things according to exact some norms, especially in different professions. And different professions tend to act according to its own culture. We heard of corporate culture, for example. So each companies, each disciplines tend to have its own way of rationalize things. Even though the value for healthcare providers, probably they are the same, to cure, to help, right? To help the patients to have less suffering and to help them feel better. But the way of doing it can be so different because of its own culture, training. So therefore, and interprofessional collaborations, the whole idea is based on this anthropological concept about cultural dynamics. So therefore, in order to promote and the development, the process of interprofessional collaborations, each member must understand the dynamics of culture and how from understanding each other's culture to respect each other's culture, right? And that becomes the foundation of any kind of interprofessional collaboration. So that is the first dimension about the application of medical anthropology to interprofessional collaboration is that among members of the interprofessional team, they must appreciate each other's way of thinking and rationality, understand each other's way of dealing with problems, because each of them will have different way of dealing with problems. So that is the concept of culture. And the second dimension is about patience. And patience has a completely different way and thinking in terms of what is most important to them, right? And what is considered as the most important task for them to do, right? What does the illness mean to them, right? And how they perceive the consequences of their health problems. So those things and are also culture, which means that only people who are in that particular situation able to experience. So for healthcare providers, and it's important to understand how patients feel about the significance of their health problems and what are their needs. And so in order to develop a collaborative approach and to address the needs of the patient have. And we also know that in today, the factors contributing to health problems are very complex. So the patient's needs also very complex. And not just individual needs. Someone required to stay in hospital, for example, that has broader consequences to their families, maybe, to their social interactions, maybe, at a workplace, maybe. All those consequences would create a tremendous amount of stress on the patients. So it's more than physical. It's more than just the problem itself. There are many, many other problems. So those problems need to be addressed by professionals who have different training backgrounds. social workers, for example, physical therapists, occupational therapists, doctors. So they must all come to a point, understand their patient's needs, understand the factors contributing to the patient's and health conditions other than physical. The patients play a very important role in this picture, and patients is the only and important purpose for the interprofessional collaborations. The history, the background behind the development of interprofessional collaborations is to try to improve communications and try to avoid unnecessary medical errors. And oftentimes the medical errors caused because of miscommunications by various professionals who are working on the same patient population. And also what is important is today is that the factors contributing to health problems are very complex. And so the complexity of the health problems also requires a great deal of complex strategies to deal with it. And so, for example, if someone have cancer, oncologist probably would not be enough, and because of you have families, you have economic issues, you have family dynamics, you have job-related issues. So all those problems tend to tangle together to create a syndrome or complex, a complex that patient must bear. So in order to facilitate the healing process or have the patients to collaborate with medical treatments, we must first deal with those problems as well: social problems, family problems, economic problems, and also rehab problems after treatment, after surgery, for example. And how can we quickly get that patients back to work? And so all those things will require different kind of expertise. And so those people or different professionals are essential for them to develop a common understanding, and not just about each other, appreciate each other's expertise, their roles they can play in providing care for that specific patient, but also understand the social implications, economic implications of the patients because of the sicknesses. And so treatment is not just about medical treatment, and treatment should also include other services so the patient's needs can be met. Especially nurses are essential in playing that kind of role and cultural competence, and tend to have quite important significance, especially for the healthcare providers who oftentimes have face-to-face interactions with patients. And I tell you a story happened in New York City years ago. And there was older folks from Asia and suffering from a type of disease and hospitalized for a week. And his son kept bringing him herb remedy, and that soup made of herbs. So of course one day went to nurse, and nurse was not terribly happy, and according to hospital rules, he not supposed to bring anything to the hospital. But for the elderly patients, and they believe that that soup is very important to his recovery, is very important to his health, and they almost got into confrontation, and because of that lack of communication. And of course, eventually, things solved, the problem solved, and but lead to the hospital and New York New Hospital decide to develop a series of workshops and training the nurses about alternative healthcare. Especially in New York City, we know there are huge number of people coming from different cultural backgrounds. So those kind of issues is quite often.
Interesting.
Cultural competence implies ability that healthcare provider has in order to understand and the beliefs, the practices of their patients, and the cultural dimension of individual. We all know that individual not always, when they come to see doctors, of course they come with biological problems. But behind the biological problems, there are a set of beliefs, and consequently, the practices relate to those beliefs that a patient would use to deal with the problems. So therefore, it is very important, essential for healthcare providers to have the ability to appreciate or understand or communicate with patients about those differences. So a proper strategies, intervention can be developed.